Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Auni Bishri with Dissociative. My matrix number is 082110. Today, I want to talk about the introduction of dissociative disorder. Dissociative disorders are mental health conditions that involve experiencing a loss of connection between the thoughts, memories, feelings, surroundings, behavior, and identity. This condition includes escape from the reality in the ways that are not wanted and not healthy. This causes problems in managing everyday life. This disease will also happen to those who are stressed with their life, so they create the new person in their body. This may benefit the patient but will harm the people around because this will happen unconsciously.
Assalamualaikum dan selamat sejahtera everyone. I 082148 Nurfazin Adina will be presenting to you about characteristic of dissociative identity disorder. The first symptom is amnesia. It is an experience gap in memory regarding personal events, including childhood experiences and everyday activities. It is forgetting how to perform familiar tasks and discovering evidence of action they cannot recall. Commonly, individuals don't remember actions or decisions made by another identity. Memory gaps may span minutes, hours, or even years. The second symptom is presence of multiple identities. The ID involves the existence of two or more distinct identities or personality states, each with its own characteristic, memory, and behavior. The number of personality so-called alters have varies widely depending on a person. In few alter cases, a person can develop up to 10 distinct personality, while in some cases involving complex DID, a person can develop up to 50 distinct personalities. Often referred to as switching, which can occur suddenly and may not be noticeable to others. Transition or switching can be gradual or sudden. Triggers for switching may include stress, sensory stimuli, or reminders of trauma. During switching, changes may occur in patient's voice or speech patterns, posture or physical demeanor, mood or energy levels.
Hello, my name is Putri Kisha Dana binti Ujidi, 081738. Okay, third is identity confusion, ambiguity in sense of self, feeling like different people at a different time, experiencing confusion about their interests, hobbies, beliefs, and values. Four is hallucination. Hallucinations are defined as false perception occurring without an external stimulus, leading individuals to sense objects, sounds, or events that do not exist in reality. Experiencing auditory or visual hallucination, often perceiving them as coming from alternate identities within themselves. Auditory is the common type of hallucination. Individuals may hear voices that can be familiar or unfamiliar, and this voice may engage in conversation with each other or directly address the individual. The experience can range from benign to distressing, with some voice commanding harmful action. Visual hallucination also involve in seeing things that are not present in environments. While less common than auditory hallucination, they can occur alongside auditory experience, particularly in DID. Lastly is mood disturbance. Experience depression, anxiety, and mood swing. May also have suicidal thoughts or engage in self-harming behaviors as a result of their emotional distress. Many individuals with dissociative disorder experience depressive symptoms. This can be linked to the trauma that often precipitates the dissociative state, leading to feelings of hopelessness, making it difficult for individuals to engage with their emotions or find joy in daily activities.
Hi, my name is Siti Hajar binti Khalid. My matrix number is 081572. So today I'll present about types of dissociative disorder. So we list out 4 types of dissociative disorder, but I will present to you 2 points above. Okay, the first type of dissociative disorder is dissociative identity disorder, DID, or known as multiple personality disorder. I am sure that everyone has been heard or read about this before. Okay, so what is DID? DID is a mental health condition where you have 2 or more separate personalities. These personalities may control your behavior at different times. It occurs due to the bad childhood experience, such as overwhelming experience, traumatic events, or abuse. To make you easy to understand, I will give you an example. Okay, so for example, we have Ali. Ali is a host of his own body. And inside Ali, there are multiple personalities such as Aminah, Abu, and Atan. So when Aminah, Abu, and Atan, they tend to talk, act, or behave differently from the original, which is Ali. when Aminah completely take over Ali's body. So Ali will be wearing a woman clothes, go to the woman place and doing what women love. Ali is unaware about this situation, but when Ali aware, Ali will be weird why he is in woman clothes when he get his nails done. This is because Ali tend to forgetting the whole things that occur to him during the whole day. The same thing goes to the other identity in Ali's body. But not all Ali's identity is good. For example, Abu. Abu is a bad identity in Ali's body. Abu can lead Ali to do a bad thing such as suicide or many dangerous things. Okay, so we will move on to the next disorder, which is depersonalization or derealization disorder. This is an experience of unreality or detachment from one's mind, self, or body. People may feel as if they are outside their bodies and watching events happening to them. Symptoms may begin in middle or late teenager years. To make you easier to understand, depersonalization or derealization is we feel like we are in a dream or in a movie. We can see we can see our own self, we can see what we do, we can see where we go. Sometimes it feels like a robot because we cannot control our own body, but we can just see our own body. So the next part I will give you to the Alifa.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Alif Aina Nabi Jalaluddin. My metric number is 082047. Today, I'm going to explain another two disorder of dissociative disorder. The first one is dissociative amnesia, a disorder in which a significant selective memory loss occurs, inability to recall important personal information, usually related to trauma or stress that cannot be explained by ordinary forgetfulness. So, this one dia berlaku memory loss yang disebabkan oleh psychological factor, disebabkan oleh stress, disebabkan oleh trauma, bukan disebabkan oleh physical injury. Kadang-kadang orang lupa disebabkan physical injury. Dan dia juga berbeza dengan ordinary forgetfulness yang biasa berlaku dalam daily life kita. Sebab this one is teruk dan specific to significant. Dia lupa certain part yang important. Especially event or period in their life yang emotionally or psychological impactful. Contohnya accident, family, divorce, abuse. So, for this kind of dissociative amnesia, dia boleh berlaku for minutes, for hours, or in rare cases, berlaku for years. Symptom dia adalah sudden gap in memory. Yang kedua, confusion about personal identity or life history. And the last one is dissociative view, which is mind traveling, a form of amnesia in which the individual leave home or mind travels away, where they take on a new identity accompanied by memory loss about their identity or life history, inability to recall past event or personal information, sometimes adopting a new identity or being confused with one identity. So dia sama juga dengan yang amnesia tadi, dia lupa past event or personal information sebab dia also form of amnesia. Contoh dia adalah someone yang experience high stress. So, dia tiba-tiba dia masuk enter the fugue state. And then dekat situ dia lost dia punya access for personal information. Dia punya identity dia lupa, dia punya past history, yes. And then dia take a new identity. Maybe the new name, living in the new city, take a new job maybe. And then without recognizing themselves in that life. And then, bila dia regain balik dia punya normal state of mind, they might have no memory of that event or that trip. One is
For the treatment will depends on themselves as well as to allow another personality to always be there or remove it through the treatment. At the same time, this dissociative disorder do not have specific medicine for the patients. And for the treatment, we have hypnotherapy, cognitive behavioral therapy, which is CBT, dialectical behavioral therapy, which is DBT, eye movement desensitization and reproducing, which is EMDR, schema therapy, trauma-informed therapy, and holistic approaches. For the hypnotherapy, which is the heightened state of concentration and focus attention, which is to allow them to be more open to suggestion to making helpful changes in their perception, sensation, emotions, memories, thought and behaviors, which is similar to the CBT and DBT, which is they wants to changes the negative thought patterns and emphasize the emotions. For the movement, for the AMDR, schema therapy, and the trauma informed therapy, which is to make the psychologist to know the trauma of you have, and wants to make you heal from the illness. And for the holistic approaches, we include the art therapy, music therapy, mindfulness, and yoga to enhance our well-being, which is to make you forget about the illness and focus of what you think you happy for doing that.
Important elements. We have two important elements, which is trauma theory and socio-cognitive theory. Into trauma theory, this theory suggests that DID is a result of repeated childhood trauma, such as physical, sexual, or emotional abuse, or witnessing a parent death, war, or natural disaster. The theory proposes that children dissociate and escape into a fantasy to cope with the pain. For socio-cognitive theory, this is the opposing model to the trauma theory.